Good morning, and thank you for coming to this lecture, which today will be on the treatment of cancer with Chinese medicine. And as I said, you're welcome to ask any questions, and you can stop me if you have any questions to ask. And as you can see from the title here, I stress the treatment of cancer with integrated Western and Chinese medicine. In most cases, I integrate the Chinese treatment with the Western treatment. And as we can see, Chinese medicine has a lot to offer in the treatment of cancer and prevention of cancer as well, and the treatment of the side effects of chemotherapy and radiotherapy, and strengthen the immune system. So it has a lot to offer. As we will see here in the beginning, Chinese books tend to overemphasize a bit, in my opinion, the role of Chinese medicine in the treatment of cancer, and especially referring to the ancient classics, as we will see in a moment. So this is the summary of what we're going to discuss today. And as you can see, we start with some of the history of the treatment of cancer with Chinese medicine. That's important to understand whether some of those ancient Chinese prescriptions apply to the treatment of cancer or not. And as I said, in my opinion, some modern Chinese books tend to overemphasize a bit the role of Chinese medicine. So as you can see, we start off with a little bit of the history of cancer in Chinese medicine, etiology and pathology, which is very important, and general approach, and etc., etc. So all modern Chinese books here, as you can see, bend over backwards to try and find equivalents of cancer in Chinese medicine. For example, as we will see soon, some modern Chinese books say that Liu, which basically means stagnation, which is mentioned in the ancient books, when I say ancient, I mean very ancient, Shang dynasty. And the Shang dynasty was about 1000 BC, or even further back than that. And they say that when these ancient Chinese books mention Liu, that's cancer. That's impossible, because they could not have an understanding of cancer in the Shang dynasty. And Liu simply means stagnation. That's all it means. Of course, you could argue in every cancer there is stagnation. Of course, there is. But it doesn't mean that stagnation is equivalent to cancer. Basically, the truth is that ancient Chinese medicine could not possibly have an understanding of cancer and malignancy, most of all. There wasn't a difference between malignancy and benign lumps. And as we will see, the Chinese interpretation of cancer is based a lot on masses, lumps, which is true. Of course, in ancient Chinese books, the masses could be cancer, but could equally be benign masses. And secondly, not all cancers have masses. If you have leukemia, which is a cancer, you don't have a mass. So you can't use the Chinese thinking of dissolving masses to treat that. It's a completely different thing. So as you can see here in this slide, cancer is a completely different disease than others. And that's an important point I'm going to make today. When we treat cancer, the thinking is different than any other disease. Completely different, as we will see today. And that's obviously because ancient Chinese doctrine, the Shang dynasty, could not have an understanding of the DNA pathology of cancer and malignancy. But having said that, we do have to have a view of cancer from a Chinese perspective as well as a Western perspective, and that will be obvious as we progress today. These are various Chinese terminology related to cancer. That's Liu. The first one, the top one, is Liu. With Liu, basically indicates stagnation. As you can see on the top right there, Liu means to remain, to stay, to keep. It's basically stagnation. Some other Chinese books say that when the ancient Chinese books refer to Liu, it was cancer. It's not. It's impossible. Okay, that's the point I was going to make, because they could not have an understanding of cancer and DNA pathology and malignancy. Yes, of course, a patient has a mass, that's Liu, but it doesn't mean they've got cancer. The second character there is Zhong Liu, which is basically a modern term for cancer, and Zhong means swelling. Another modern term for carcinoma is I, as you can see there. And interestingly, two terms for cancer have the character for mountain. I guess it's to indicate something hard, a big mass, and something hard, like a mass. As you can see, the character there for I at the bottom has a mountain. That one is a mountain, Sha. And this is breast lump, also as a mountain there. And those are modern terms for carcinoma. It's a modern term for carcinoma, but it was used in the Sung dynasty as well for the first time. 1171 is the Sung dynasty. And you can see here an analysis of the character. This character here on the outside is Bing, is a character for disease. If you see any Chinese character with this on the outside, it's a disease, it's some kind of disease. And inside there is a mountain, and this is a mass hard lump. So that's very clear. It's a disease characterized by a mass hard lump, presumably as hard as a mountain or as hard as a rock. And we see the mountain again in the term for breast lump, Ru Yan. This is breast, Ru Yan. Or another modern name for breast lump is Ru Xian Ai, breast cancer. Ru Xian, this means gland. Okay? So one point I wanted to make in this is that Liu, modern Chinese books say that Liu is cancer. It's not. It's purely stagnation. And these are two characters which recur a lot in the Neijing and the Su Wen, a lot, for masses. Jiju and Zhengjia. Ji are masses from blood stasis, and they are not movable, usually painful. And Ju are masses from qi stagnation, movable, usually not painful. Again, this has nothing to do with malignancy or not. Okay, these terms are already in the Nanjing, and the Nanjing was written around, well, no one knows, 100 BC. So they are purely masses. It may or may not be cancer. Okay? And G are the hard ones from blood stasis. Anything from blood stasis, by the way, is hard, as we will see when we talk about diagnosis of cancer. A breast lump, if it feels soft and movable, it's a benign mass. If it's hard, it's always a bad sign. And it doesn't necessarily mean it's cancer, but it is a bad sign because it indicates blood stasis, and blood stasis is worse than qi stagnation, which is a point I make a lot in my lectures. There is a kind of an overemphasis on qi stagnation in diagnosis and in treatment, in my opinion, and especially liver qi stagnation. I don't know what your experience is, but it's, in my opinion, overemphasized. And qi stagnation cannot cause any serious disease. You can't get cancer from qi stagnation, period. You cannot. If you've got cancer, there are other factors, primarily blood stasis, secondary phlegm, third, toxic heat. So it's strange that there is such an overemphasis on qi stagnation and not blood stasis. I don't know if you've seen it. There is a book by a Chinese doctor, Yan Dexin, on blood stasis. I don't know if you've seen it. Yeah. By Blue Poppy Press. It's a modern Chinese doctor called Yan Dexin, and he has this revolutionary idea about blood stasis and aging, that the diseases of old people are not kidney deficiency, as we always say, right? But they are blood stasis. And blood stasis causes the modern diseases that people die from: heart disease and cancer and stroke. These three. Of course, yes, it's a good idea to tonify the kidneys in an old person, of course. But the diseases we die from are from blood stasis. We don't die from kidney deficiency. Okay? So these terms are very ancient. They are from the Nanjing. And Ji is blood stasis, Ju is qi stagnation, and the same for Zhengjia. These two are basically the same. Zhengjia is used in the context of gynecology. But men can get Zhengjia too. And as you can see here, Zheng is equivalent to Ji, blood stasis, and Jia is equivalent to Ju, from qi stagnation. And if you, in Chinese, Zheng means true or real. This suggests that's a real mass. You see? And Jia, without the disease radical around it, means false. So it suggests a true mass and a false mass. The true mass is the one from blood stasis, and the false one from qi stagnation. But I want to repeat a very important point. You cannot get cancer from qi stagnation. Okay? Of course, in many cancers, I would probably say in most cancers, it starts, the very, very beginning will be qi stagnation. There is qi stagnation, there is. But qi stagnation by itself cannot cause malignancy. Okay? And as you can see, the abdominal masses Jiju are in the Nanjing, chapter 35. And it says Ji masses are yin, Ju are yang. When qi accumulates, qi stagnation gives rise to Ji masses. When qi gathers, it gives rise to Ju masses. Notice what it says. Ju masses, the real ones, have a fixed location and usually painful, not necessarily painful, and have boundaries above and below and edges to the right and left. That's strange. Right? Why is it strange? Because it suggests they have defined borders. In Western medicine, it's the opposite. If something has defined, if a breast lump has defined borders, that's good. If it spreads out, it's bad. So it's the opposite of what the Nanjing is saying. Notice the Nanjing is saying the Ju masses have a fixation, have boundaries above and below and left and right. That's the opposite of Western medicine. If you feel a lump in the breast, a hard lump with clearly defined edges, that's good. If the edges are not defined, it's a bad sign. And that's why I say here, this is the opposite of what we would say.